Well, welcome everyone to our webinar, Selling to Survive, the last one standing in long-term care. My name is Emily Trask and I will be your moderator. I'm pleased to introduce today's speakers, Irving Stackpole and Pete Middlemass. Today's webinar is being recorded and will be made available to all participants after the webinar. We'd love to hear from you during today's presentation, and we'll be answering questions at the end of the session. If you have a question, please feel free to send it through the Q&A or chat. And if we don't get to your question today, we will be sure to follow up afterward. This program has been approved for 1 continuing education credit through NAB NCERS. So without further ado, I will pass it over.
Great. Well, good afternoon. My name is Pete Middlemass, managing partner with Northeast Healthcare Consulting Group. And I would like first to thank Irving and Stackpole Associates for inviting me on today's call. I've known Irving well over 10 years. He's been a great mentor and advisor to me personally throughout my career. And so with that, we've got a lot of great content we'd like to share with you today. And I'll get us kicked off. Let me just share my screen real quick. And excuse me for a second here. All right. Just a quick check. Can everybody see my screen?
Yes.
Fantastic. All right. Well, let's talk a little bit about today's agenda. We've really sort of broken down our agenda into 2 separate and distinct areas, and largely because you can't have one without the other. One creates some efficiencies that allow us to be more impactful and more effective in our sales roles as business development leaders and sales folks out in the post-acute space. So our agenda for today, I'm going to first open by talking about sales systems and what is required of effective organizations today in order to either disrupt the market or to lend in your census and recovery and to be a leader within your respective markets. Well, first, let's, as a follow-up to the marketing mayhem, which is still available on our website, a lot of what we will be looking at are the skills and tactics for surviving in the long-term care space. Effective sales is a part of our last one standing strategy, right? But in order to be effective in that role, we really need to understand that the notion today, our sort of standard operating procedure is, and I hate to use this as overused, is doing less or doing more with less. And so, and that's not just for post-acute providers, skilled nursing operators, senior living, but that's across the entire the care continuum. But the sales function is not immune to that, right? And so with eroding margins caused by, say, decrease in length of stay, shifts in payer source from Medicare to Medicare Advantage, to increased labor costs and changes in our referral patterns, diversion from skilled nursing to other levels of care. Bottom line is organizations today continue to struggle with growth, or I would argue even defending their current census. Today, we're going to discuss some specific sales tactics that you can employ to yield better business results and to survive and navigate through our ever-changing landscape. So in order to do so, the first thing we need to do is really to free up our sales talent. When we think of our sales talent, we think of their body of work and where they are spending their collective time today. Largely, it's not in the sales function, it's just processing. And so we're going to talk about some things that you can do today to help create additional bandwidth to free up those sales folks so that we can do what we brought them on board to do, right? So by leveraging our sales talent in a manner that optimizes their performance will be key to your survival. By aligning the so-called, what I refer to as talent with the task, operators can focus their sales professionals on those activities that help further their relationships with either the health systems, PHOs, physician organizations, or the community at large. One way to create better alignment is to better utilize technologies and efficiencies in your workflow. Reducing or eliminating clerical activities or duplicative efforts for your sales team can help allow them to successfully execute on a strategy to achieve your organizational goals. And those goals vary from operator to operator, from organization to organization, from market to market. Whether you're looking to increase referrals or conversions, looking at get a better quality payer mix, either recover or increase census and occupancies, create or form strategic alliances or collaborative agreements with your upstream providers. Could also include looking at clinical niches, service differentiators, right? Being thought leaders and coming up with innovative ways to further the relationship with your upstream partners, right? Whether we're looking at alternative payment models, maybe it's an EPM, an episodic payment model, or just in general, if you're just looking to be the leader in your space. I was just recently meeting with the head of a very large organization based out of Atlanta, Georgia. And he looked at me and said, Pete, we just want to be the best. And in order to get there, they recognize that they need to change the way that they operate, the change in the workflow so that they can achieve those respective goals. And so a lot of what we're going to talk about today is going to help you sort of connect some of those dots to help you get along, to push you along a similar path. So when we talk about harnessing technology, successful organizations who embrace technology realize significant time and cost savings while increasing their bandwidth for their sales team, again, as I alluded to earlier, to do what we hired them to do, to sell. By incorporating technology into your company's organizational growth plan, operators and sales leaders can streamline their sales processes to allow for more next level sales activities that drive better business results. Well, what are some of the key components to automated sales system? When we look at automated sales systems, there are key things that need to be incorporated that are going to help you improve your business results on a number of different levels. First, and I'm not going to go through all of them, but just touch on some of the highlights. One is, these automated systems by design today are allow for creating process efficiencies through streamlined workflows, reducing, as I mentioned, redundancies or duplicative effort, providing real-time transparency, and so the real understanding, not just as a sales contributor, but also as a sales leader and an operator, understanding what that sales funnel looks like at any given time so that it will aid you in making better business decisions about how and where you deploy those resources. Also provide you with information that's accurate, that's real time, not with historically where we've had lag. And that is especially important as we try to understand with all of the varying financial dynamics in reimbursement today, where the good business is at, so that we can make good, solid, educated, and fiscally responsible decisions. And also to mitigate our risks, whether we're looking at, as we prepare to care for a guest within our care setting, to make sure that we can clinically meet their needs, that they're financially viable, and that we've met all of the regulatory requirements that are put upon us within our space. And then lastly, sort of allow us to be able to really have a greater insight, maybe another way of looking at it is back-end reporting on where our business is going and where that missed business opportunity is. And having that level of understanding very specifically and pointedly, either to a market, to a health system, or to an entire portfolio, is key in helping to steer and navigate your organization to achieve your goals. So other components of the automated of sales system really require that you have a centralized repository, real-time access, seamlessly automated electronic data for a number of different reasons, not just time savings, not just cost savings, but to make sure that we have the right information that is being transferred from one care setting to the next. A perfect example is, every time that we have to have one of our individual contributors take information from one electronic platform or other platform and rekey it into another, there's always the risk of making mistakes. Think about copying in orders for meds. The difference between 2 ml and 200 ml, obviously is a huge concern. And so making sure that we've got the right systems in place to create efficiencies in our model, but also to promote accuracy in our data capture. We also want to be able to understand where we are with respect to that data and be able to track response times. Many times, we anecdotally say, oh, well, it's the hospital or it's the managed care provider that's, failing to give us timely pre-authorizations. Well, many times internally, we are unaware of where our own bottlenecks are. And so having automated sales systems to be able to capture that, track and record helps us to understand how we can better manage that workflow, create better policies to get to yes faster so that we can convert more business. And it also tells us what areas or aspects of that pre-admission and review process has opportunity to improve upon those results. And then lastly, that back-end reporting structure has never been more important for helping leaders like ourselves to make better educated decisions that are going to help us achieve our financial and growth goals. Well, the good news today is, as I look back as a consultant, I look back 5 years ago and the solutions that were out there, quite honestly, weren't ready for prime time. They weren't very robust, and the data that they did allow for improvements or enhancements that give us that insight that allow us to create some economies of scale and efficiency simply weren't ready for prime time. And so I'm happy to report I've worked with many different operators and have partnered with many solution providers. And those might just be software companies, or they could be companies that go in and help organizations really understand how to create efficiencies in their workflow. I mentioned just a moment ago, the notion of getting to yes faster. We have a saying in business development. We used to say, first to bedside wins. And what that means in today's, it's more, it's not literal because many health systems don't let us in the hospital. But with the first to bedside wins, meaning the first person to get a yes answer has the highest chance statistically of converting that book of business. And that contributes significantly to top end revenue and to help you with your better manage your census and occupancy goals. So there are a lot of systems that are out there today that either replace some of the CRM functions of our existing platforms. I just picked two of them here. Point click care is sort of our de facto standard. I would argue Matrix Care probably number two. But anybody who's used these products, and I mean no disrespect to PCC or Matrix Care, but the PCC CRM module was designed for senior living. It was not intended for skilled nursing. I actually came from Genesis, working 10 years with them, and they had IRM, which was specifically designed, but very cumbersome. And then Matrix Care Referral Connect, there's a lot of opportunity to improve. And so the good news for operators and business development leaders today is that there are tools out there that can help create better efficiency in your workflow and help with better, higher quality and more accurate decisioning along the referral and intake process. So one of my clients is engaged with a regional skilled nursing chain based out of the Midwest, largely in Ohio and in Michigan. And the name of the company is called Alter Care. And this organization has had implemented a solution that was developed by Linkware. That's just one of several of the different providers that are out there. This one's a good one. And they provide an end-to-end solution that helps organizations look at what that workflow is, look at what those policies and procedures they have in place, but more importantly, marry it to the culture and the existing structure within that respective organization, whether it's a one-to-one relationship with a hospital in a facility or a clustered market where it's a one-to-many relationship. And they build a platform that is designed to create efficiencies in our model, to reduce a lot of that clerical activity. Again, from the onset of the call, I said, aligning the talent with the task. paying a registered nurse who arguably, and depending upon what market, we're paying them $80,000, maybe $85,000 a year, plus 23.5% fringe benefit. To have them perform clerical functions really is contributes to higher cost of sales, but more importantly is not a good use of their time when they could be furthering our relationships with our upstream partners and key influencers in a way that helps us again to achieve our individual business goals. So for this particular case study, AlterCare was able, as a post-implementation, they have 25 sites of service, and they did a pilot, and coming out of the pilot, they realized a 20% increase in their referral capture. And correlating to that was a 15% increase in the conversion of the referrals that they were receiving, which contributed overall to a 12% increase in census. Let me pause there and have you really noodle on that. Those are significant numbers. And when we look at sort of industry averages around conversion, and when we look at sort of the fact that from a skilled nursing perspective, the pond that we're fishing in, the proverbial pond, has fewer fish in it today than it did 5 years ago, 10 years ago. And so the importance of making sure that we convert as much of the business that's being presented to us has never been more important. And so harnessing technology to reduce a lot of those administrative efforts and to create clarity and allow us to perform better decisioning activities helps to contribute to increases in our business performance. With that, they are also able to decrease their customer response time. This organization has a stated goal of getting back to their customer within 30 minutes or less. They're proud to report, in fact, they brag about the fact that they get back to, on average, to their customer within 15 minutes. And anybody who's been in this business a while knows that within 15 minutes, those good patients are gone. The ones that are still there an hour or two, multiple comorbidities and likely have some other issues that present with that patient, right? The other thing they were able to do is make significant reductions in their cost of sales. And not just in terms of a reduction in full-time equivalents, which they were able to they didn't reduce their sales force because of the staffing shortage, which I applaud them for not doing. What they did is they retasked or reallocated those nurse resources to other more vital and equally vital areas of their organization. And so, but from a cost of sales perspective, they were able to reduce anywhere from 3 to 4 full-time FTEs. And then as through attrition or as they had new folks come on board, they found that the caliber of the individuals that they needed to hire relative to their salary requirements was much, much less, because we had systems that were set up and designed, whether it's a clinical review or the financial review, to aid with that decisioning process. So significant. And then the last two areas that they've shared with me that were of equal importance is with respect to onboarding and staff turnover. When you have a system that is standardized, when you have a system that is kind of wizard driven, if you will, it allows for much faster onboarding and ramp up time for key resources. Think about when you have a liaison leave your organization, you've got that recruitment time, then you've got the onboarding time, and it may or may not, it may be up to 6 months before you get them up and running and fully productive. Harnessing technology and having an automated system to aid you in that pre-admission review process allows you to streamline a lot of activity and allow for a much, much faster ramp up. And then lastly, on reporting insights, having the ability to truly understand where that lost business opportunity is by tracking and trending dispositions from outcomes, whether we denied a patient or whether we were rejected by a patient, and understanding those reason codes helps us as leaders to make better business decisions on where to make our capital investments, but also how to better align our resources. And then lastly, to be able to look at what the market trends are, because if we are able to fully capture that data and be able to track and trend and baseline that certainly allows us to understand where we fit in that ecosystem. So as we talk about making investments in technology, Embracing current technology to aid your organization in achieving a more seamlessly integrated care delivery model, we're able to focus our time and resources on listening and adapting to the changes in our healthcare landscape. And I would also argue there's a lot of buzz today about AI, artificial intelligence. Well, that technology is coming to us, and it's coming to us very rapidly. And I would argue the folks that are embracing technology today are the folks that are going to be best poised to be able to adapt to and adopt and evolve their organization to make further investments in AI. And that will in turn allow us to be poised for success in the future. So as we talk about harnessing technology as a way, current state today, to help better prepare us to navigate through changes and to better arm our sales force by giving them more bandwidth to go again, do exactly what we hired them to do, is to further our relationships, to get to those next level sales is critically important to our success. Elevating the sales acumen and developing relationships in what I would argue is an already crowded theater requires a unique set of skills necessary to disrupt the market and to beat out the competition. So the next section, what we're going to do is examine specific sales tactics and strategies that, well, when employed appropriately, will yield outstanding results.
Well, thanks, Peter.
Would you like me to stop sharing or would you like me to continue for you?
Thanks, Peter. Terrific presentation, and we start, as I like to say, and everybody knows I'm from Boston. We start with the system, in part because the systems for selling in long-term care, with very few exceptions, have been technologically backwards, somewhere in the Jurassic Age, I think, antediluvian. And in order to achieve efficiency in the markets, systematizing the relationships and the sales processes, as Pete so expertly described, is mission critical. And it's a strange domain for many long-term care providers, but absolutely critical. And the three areas that I'd like to repeat before I dive into my psychological and behavioral discussion is the issue of alignment that Peter talked about. That is to say, making sure that every member of the team is aligned around similar goals and tasks and objectives. And then efficiency, making sure that you got the right people doing the right things. As Peter says, it's not just necessarily about cutting costs, it's about rededicating, reassigning, retasking, I think was the clever term he used, retasking people into proper roles. And then finally, understanding. And there's a tremendous lack of understanding in the sector overall about why we succeed in some sales interactions and why we don't. And in the past, the idea of going to people who did not choose us, going to understand from hospitals or a doctor's office why a certain case went to another provider, that's incredibly important, but has not typically been done. And as Peter expertly described, is a rich trove of information and insight that we need to delve into. This program is titled Selling to Survive, but I want to point out that we're not talking about survival or selling at any cost. For those of you who are concerned about such things, hard closes, that is to say, being aggressive about closing a sale, is a dead end thing to do. It's just not going to work. The research is very clear that the harder you press, the more resistance you're going to get. So we need to understand that there are far more effective and prudent ways to manage the relationship where there's an expectation that you as the salesperson, you as the marketing professional, you as the provider of long-term care services, that you want to have an ongoing sustainable relationship with your upstream referral colleagues. The last thing you want to do is to try to inappropriately influence a decision to refer to your organization. And many of you, if you're like our clients, are thinking to yourselves, well, I'd just like a chance to influence some of these interactions, but I'm going to talk about what you can and should not do to appropriately influence the decision to refer a particular case or categories of cases, or to use you as a preferred provider. And I'm going to say there's ways to correctly use influence, and there's ways to incorrectly use influence. And I call that smuggling influence into situations where it doesn't belong. And of course, there's a very, very high price to deception. If you take on a case and you can't handle that case, there's going to be a lot of people who know that you've been unable to handle that case and that you exercise some deception in that transaction. Negative news travels fastest. I was just talking with some friends over the weekend about why the news is also negative. And you've probably heard the truism, if it bleeds, it leads. That is to say, if it's negative, that news travels fastest. It's just a characteristic of human nature that media companies and even friendly chit chat, the negative news always goes fastest. And we, as providers of long-term care services, should have a policy about truth and deception. That is to say, we adhere to the truth and we rigorously avoid deceiving our customers. So I'd like to share with you a little bit of Muppets on this feature of selling.
You need to share your sound. Sorry, Irving,
Sorry.
there.
Okay, I'm not quite sure how to do that. So
Where your sharing option is, there's should be ellipses and it says share sound, not in YouTube, in the video itself.
in the video itself.
No, in Zoom. Sorry, I'm sorry.
Well, this is a very delightful video. I'm not sure that we're going to get to see it. So let me see here if I can do this. We should have practiced this.
Sorry. Yes.
Share.
If you open up the full slideshow again,
Okay.
where you have where the options for screen sharing are, there is an advanced sharing option, then it says sound. I can get it ready for the end.
Okay.
If you want to just continue.
I'll just continue.
Yeah,
Press ahead.
thank you.
It was very funny. That sound of silence that you hear. Okay, so what do we know about trust? Trust is an essential ingredient of all successful relationships, and it's certainly successful provider, referral source, and intermediary relationships. Trust is essential. So who do we trust? Who do you trust? And why do you trust them? Very interesting research in this domain that we need to rely upon because we can affect behaviors and communications that will build trust, or we can erode trust. By the way, I want to mention that at the end of this program, you'll have access to the slide deck, which includes references and some very effective research about trust so that you can apply these tools yourself. So we want to learn to be trusted and to demonstrate the ethics associated with trust. Many people, when we talk about influence, believe that influence is somehow fundamentally unethical. Is it unethical to exercise influence over another person? It's my personal belief that the most effective salesperson I've ever encountered was my 5-year-old daughter on a hot summer's day who desperately wanted an ice cream. If anyone has encountered this environment, you know that this person, this very small person without any training, is an enormously effective salesperson because she understands the components of influence and engages them beautifully. So influence is invisible. It's the power to affect others, and you only see it in the results. I would say that influence is not inherently unethical, and that it's absolutely essential in personal and business relationships. Excellent research has shown that there are 7 influence factors, and these cut across cultures, they cut across generations, they are almost neurophysiological, and that these 7 influence factors are the essential sales skills for our relationships with referral sources and intermediaries. And we can bungle legitimate influence opportunities, or we can smuggle influence opportunities into situations where they don't belong. I am in no way suggesting that we smuggle influence opportunities. I believe, however, equally strongly that we must not bungle or miss opportunities. So there are 7 influence factors. I'm going to run through them very quickly and then offer you some examples of each in the post-acute care setting. The first is contrast, and that's that our experience of something is significantly altered by what we experienced just beforehand. Reciprocity, we are all moved and influenced by a gesture that we receive from someone and feel obligated to return that gesture. Scarcity, the absence of some objective or feature, is far more compelling than the presence of that particular feature. Consensus means that we as human beings are significantly affected by what other people do and say. How many people have looked at a restaurant parking lot and said, well, that must be good because there's a lot of cars in the restaurant? Well, truly, is the parking lot any indication of the quality of the food or the quality of the service? Hardly. There's commitment and consistency in that we are driven to be consistent about our previous commitments. And I'll show you how to engage this in the post-acute care setting. And then there's friendship and liking. And this is as old as any used car sales environment. You latch onto something that's familiar. Oh, your son or daughter also goes to that school. You have a teenage daughter. That's friendship and liking and leveraging those. So the first of these is contrast, in that you can change perception based on what is experienced just before. And the application in our setting is to lead with your very best features. That is to say, in post-acute care, if you have a particular specialization, if you have a particular relationship that's quite prestigious, you're affiliated with a known medical school, you've got interns and residents, you've got nursing students. Lead with your best features and present those quite upfront. We have affected modesty in many sectors of our society. And this is a situation where that modesty doesn't apply. One of the very simple applications of this contrast principle is with regards to the credentials of our staff. We want to put those out front, and that has a double effect, which I'll talk about. So if you're looking at a situation where you have a very expensive room or a very expensive service option, if price is a factor, you want to show the most expensive first. And this seems counterintuitive. We typically want to show a very modest cost option, believing that we can move the person up the scale once we've secured some level of commitment. The research shows that that's not the way to go. That's not correct. Another example, and there's a reason that there's a muffin there. We used to call this the Great Muffin Debate. We are obligated to return to others the same form of behavior that they have shown to us. And in the old days, when I started as the director of marketing for a chain of rehabilitation centers, we used to have the liaisons, the marketing representatives, really salespersons, take muffins and coffee to the hospitals and to the doctor's offices in order to engage this influence factor of reciprocity. I know we can't do that now. These days, influence is the influence factor that we use is information. The influence factor that we use is a solution to their problems. We enter the conversation with an upstream referral source, already having a solution to a problem that they have, and that is every bit as effective as a blueberry muffin. So we want to offer something of value, not an open question about how many cases they refer or what types of cases they treat, what types of challenges that they're having. We should know the answers to those questions before engaging in the sales cycle with them. And we should offer something of value, which is in this case, a solution to their problem. The other influence factor is scarcity. And the principle here is that people, and this is everybody is more motivated by the potential of losing a benefit than gaining the same benefit. I'd like to repeat that because it's tremendously important. The loss of any benefit is far more compelling than the gain of that same benefit. And how it's applied in our environment is by using the perception of scarcity. You don't want to try to say, well, we don't have any beds available for this particular patient when you've got lots of empty beds. But for example, if your staffing is at a critical level and you have available staff to care for this particular case, then that should be a key solution, a key feature that you offer as a factor of scarcity. This particular occupational therapy setting has the capacity to take care of 2 additional patients this week. And it would be great if we could get this patient transferred to take advantage of this opening. It would be a pity if that were lost. So you're ending the conversation, the features, advantages, and benefits. You're ending the conversation with the specter that this could be lost. Please do not try to smuggle or deceive consumers using scarcity if you're not comfortable using it, or if scarcity doesn't really exist. Another tool that I've used in the past is scheduling events at a particular center or with a particular service provider when there are lots of other things going on. So many times, directors of nursing and skilled nursing or post-acute care centers will not want to have 2 or 3 events going on at the same time at the skilled nursing center. But that's exactly when you want to have the case manager from the hospital visit to talk about a particular case or to attend a particular training program. You want to create the impression legitimately that yours is the place to be and that this is where the action is happening. And that's scarcity. That's sort of using the inverse of scarcity. Another is authority. And the principle here is that people are inclined to comply with perceived authority. And one of the exercises here is to invite participants in a meeting to show their business cards. Now, many of us in an affected self-modesty don't print our degrees on our business cards, to which I say, why? The business card is an opportunity for you to display authenticity and authority. One of the examples I offer is that we were invited to look at a hospital's cardiac rehabilitation clinic because the compliance with the post-cardiac treatment outpatient treatments was very poor. It was only 13 or 14%. We interviewed consumers, understood the situation, and learned that the patients who chose not to come for the outpatient rehabilitation didn't understand the credentials and the professional training level of the therapy staff at the outpatient center. So what we did was we created a whole wall of authority by getting all of the degrees, all of the certificates, all of them from the therapists, the occupational therapists, the others that worked in the center, and we occupied an entire wall with these credentials. And almost immediately we saw an uptick in the compliance, the return visits by post-cardiac treatment patients to the outpatient rehabilitation center. Because the patients, the consumers, just didn't understand that these individuals had this extensive training and had so many certifications. So the trite way to say this is communicate your affiliations, communicate your credentials. And going back to what I was saying about the prior influence factor, this is where you want to display your accreditations and your affiliations. If you're operating in Boston and you're affiliated with one of the Harvard teaching hospitals, why not have that on your website? Have the logo on your website. If you're in California, Southern California, or affiliated with USC or Stanford, why isn't that clearly on your website? So we want to communicate affiliations and accreditations, degrees, and the credentials of staff. Very important. Consensus says that we are influenced by how we think or feel by what others think or feel. So you know that there are people who believe that a restaurant is great because the parking lot's full. I've had the exact opposite experience. I was invited in to try to understand why a particular assisted living residence was having so much trouble. And when I pulled up to this building, which I hadn't seen before, it was beautiful. And the parking lot in front, all of the surfaces had been repainted and all the lines were clean and white. There were no cars in the parking lot. The place looked empty. And when I got in, I just got into the building. I discovered that that's because all of the staff and all of the residents that had cars, they were parked in the back because the executive director decided that the front parking lot looked too nice and she didn't want it all messed up with all of those cars. So one of the first things we did is we had all of the cars parked in the front to show that the building was indeed busy. So we want to appear to be the place to be, in part by scheduling and in part through what we do, what we show. We want to schedule for consensus. We want to have training sessions and take the pictures that show the heads in the room. We want to manage those images so that it clearly shows that our center is the place to be, or our agency is busy, is the place to be. Okay, commitment and consistency. So we are driven to, we have a relentless desire to be and to appear to be consistent with what we've already done. Now, what this means is that if your upstream referral hospital, I'm just going to call it general admitting hospital, if general admitting hospital has in the past referred patients to you, I don't know, but general admitting hospital's logo should be on your website. Not only that, but the case manager from general admitting hospital and your director of nurses, if you have a picture of them together, that should be on your website. That should be in social media. When you create images that show the referral professional, the referring professional with the provider professional, you've created an obstacle to that individual removing herself from that relationship. You've created a barrier to exit. So publicize endorsements and then add in the authority. Use the credentials, use the names, use the logos. And this is easily done in social media and on websites. And you want to create and distribute these symbols, that is to say, logos and brands associated with your environment. So friendship and liking, we're more inclined to say yes to people we know and like. And the application is you want to try to match the people with the staff person, listen and learn about them, and use your CRM, as Peter was talking about, to collect information and to show people that you are indeed aligned with them in more ways than one. What we know about body language is that most of the messages that people receive are nonverbal. We need to be aware of appearance, aware of position. If you have in-person meetings, this is a very good way to position yourself with another person. You want to deliver from the left so that the audience receives from the right. This is especially important in situations where you have difficult messages to share with your audience and with your consumers. So you want to deliver from the left and receive from the right. This is also a very good position to achieve cooperation, but always ask permission. Ask permission before moving your chair into that type of environment. You want to avoid the situation where you're standing across from someone, sitting across from someone. This is a competitive and defensive position. And in an environment or a room where there's multiple seats, a clinical case conference, a family conference might be in this type of environment where there's a wall. The power position is with the back to the wall. The emotional glue, the emotional connector is in the middle of the room. So we want to consider that it's not what you say, it's what people hear in all sales environments that count. And that's so important that amid this marketing mayhem, efficiency is the new grail. Sales systems are key to those efficiencies. Behaviors, methods, and messages are critical skills to sell and survive. So with that, I'm going to see if there are any questions, and I'm not quite sure how to move. See, you'll get these references and endnotes to the audience when you're in your follow-up. So
And
I'm going to stop share.
we have an attendee who has their hand raised. And Carol, would you like to ask a question out loud if you'd like to speak and unmute yourself?
Well, hello. No, I actually don't have a question. I'm sort of identifying with you because I spent a lot of time in my career with customer service and teaching. So just wanted to say you're right on point, and I completely agree with you.
Right. Thank you.
Thank you.
So I have a question for Peter. If you're still there, Peter. Have we lost Peter? No, he's still there.
Here.
So you talked about the benefits associated with implementing certain technologies to improve sales efficiency and effectiveness. Can you just talk about some of the obstacles that you've seen in your experience working both as an executive, a sales executive, and as a consultant in these environments? Some of the obstacles that you've seen in introducing or implementing some of these technologies and how those were overcome?
Sure. So my career spans. Healthcare for me is a second career. I grew up in finance and accounting in the CPA world very early in my career, and so I'm truly, while in skilled nursing, I've worn a business development hat or a public relations sort of individual. I'm always drawn back to the finances, right? And in healthcare, with very, very thin margins, the first thing that's on the minds of nearly every operator whom I engage is, look, we don't have any money. And I get it. So that everything that we do has got to provide an unquestionable value, has got to demonstrate an ROI. And so taking them down that path of being able to say, listen, the old adage, you got to spend money to make money. Well, there's an ounce of truth in that we as an industry have been very slow to adopt or embrace technology. We know this, right? And it's not because we're bad people. It's just because we come from a highly, highly regulated environment. And quite honestly, I don't know that the solutions that were out there, as I mentioned earlier in my presentation, were really providing the level of return on investment that we desired. And so working with operators to look at, when we look at building a solution, really identifying what those specific areas of business impact need to be. And they need to be measurable. And if we can get to that point by saying, if we can do this, this, and this, and achieve that goal, then they're more comfortable about that investment, right? And then the other is really, looking at today, the notion of being asked to do more with less. With finite resources, everyone's wondering, how are we going to implement? And so partnering with the right firm, not just the right solution, is also key to this, is key to its success. As a business development guy, I typically, it's kind of easy to come up sometimes with strategy, right? We come up with a plan. The hard part is executing the plan and getting it over the finish line. And so giving operators confidence that that solution not only is the right solution for them, but that we can implement it effectively to be able to yield and demonstrate those results. And then the one last thing I would add is, as we are thinking about creating change, many times we are not, if we're being honest, look in the mirror, we are not good at change. We don't respond well to change. We're not creatures of change. And so, we, as adult learners, we've got early adopters, mid-stage adopters, and then end stage or non-adopters. And so changing the culture of an organization many times is equally as difficult as actually introducing the solution itself. Yeah. And so factoring all of those things in and having sensitivity to that really is part of that sort of secret sauce or success quotient.
Right. The culture needs to change from being receivers to being innovators. That my experience in the sector sounds similar to yours, that historically the skilled nursing post-acute care providers, whether it's a home health agency or skilled nursing or an LTAC, that they have been the receivers and awaited receipt. And now we're trying to change that dynamic. We're trying to move into an environment where we are innovating and inserting ourselves into the referral stream. I want to see if we have any questions. Emily?
Yes, I have two. How can we sell to hospitals when they won't let us in?
You want to take that, Peter?
Oh, that's a fantastic question. You know, a couple of things that the COVID pandemic has taught us is to be more resilient to change, right? You know, we're along the same theme, being agents of change. You know, what we quickly learned, the lessons from the pandemic, is that we've got to think differently about how we approach and engage our upstream provider. And keep in mind that they have now figured out that they don't need us in the hospital. They got along just fine having, the ability to kick us out. So what that means is that as we are looking to further our relationship, we have to look at utilizing new vehicles to deliver that message and to better engage them. And so we talk about virtual relationships, well, just as we're doing right here now on a Zoom call. Years ago, Zoom was like, wow, we're on a webinar and everybody would get nervous. Now it's commonplace. Oh, let's just hop on a Zoom, right? And so figuring out how to message and as Irving mentioned, majority of communication is nonverbal. And so being able to look at technology, harness that technology in a way that you're still sensitive to the needs of building those relationships. And so that requires something that is a little bit more thoughtful and tactful in our approach. So it's not just having this one call, but how do we then follow up and say, wow, it was really nice to meet you today. Something resonated with me, what you had said, and I just want to get a clarifying something, right? So you're creating excuses to keep out and maintain that relationship, that level of engagement, so that you can build that trust, and it can be built. That's one of the positive things that we learned. We're able to do our jobs without having to, get on a plane or driving, sitting in Atlanta traffic for 2 hours or Seattle traffic, whatever that may be.
That's right.
Right, or the 405 in LA.
Right.
And so we can achieve those goals, but it requires a different approach.
And one of those approaches is looking at information and solutions as the key vehicle. No longer the blueberry muffin, but it's the solution to the 2 percentage points above the nationally recommended readmissions, all-cause readmission or cardiac readmissions rate. If an upstream referral hospital is 2% above the national standard, you go to them with a solution. And if you bring a solution, they will talk with you. They may even go to you. If you have a legitimate solution, you put on a webinar, you put on a program, you introduce them to your coordinated episode of care for post-cardiac rehabilitation, they'll listen to what you have to say. So are there other questions, Emily? I'm sensitive to the time.
Yes, we have 1 minute left, but we have one more question. How has consumer awareness impacted the ability to sell?
Oh, wow. So let me start with this one very quickly. I think it's been both a positive and negative. For skilled nursing in particular, nursing homes, consumer awareness was forged in the pandemic in a very negative light. And that needs to be addressed and addressed correctly. And we have a whole program, a whole series of documents on the website about crisis communication and managing that. The second thing that it's done is it's heightened the awareness of skilled nursing in the communities with the press. So there's an opportunity now to communicate with consumers in our marketplace areas in a way that hadn't been there before. Do you want to add something to that, Peter?
Yeah, I think, with every cloud, there's a silver lining. And yes, it started as more service recovery for us with our consumer direct, right? But I think too, for those who understand how to, again, utilize the various, whether it's a social media platform or professional media platform, to be able to create top of mind in a positive way, to rebrand themselves in a positive light, allows that the consumer actually can come in with a bias before the episodic event. So when the case manager is giving them the proverbial 3 choices of skilled nursing providers, they could say, no, look, here's the one I want to go to, because we've reached out to them, we've created some level of brand awareness with them, and so we can get them to the point. And those are organizations that work very diligently, are savvy at this, can get them to say, no, I want this company.
Right, right.
Competitive advantage.
Okay, that's all the questions that we have. Thank you very much. So thanks to everyone for attending. We hope that you found it informative and useful. Please take a moment to tell us how we did. You'll be sent a survey at the end screen, which will all help us to improve our presentations. Thank you again, Irving and Pete, and hope to see you at a future program.
And thank you all for your time.
Thanks.